He died in his sleep because of this. Stop doing it, I beg you. It leads to heart attacks and strokes. What you are doing tonight before you go to sleep, right now, tonight, could be the exact reason your heart stops somewhere between midnight and 6 a.m. I am not being dramatic. I am being accurate. There is a habit, a nighttime habit, so ordinary, so completely normal looking that millions of people over 50 do it without a second thought. It does not feel dangerous. It does not cause pain. It does not trigger any alarm in your body while it is happening. It works in complete silence. And while you sleep, while you believe your body is resting and recovering, this habit is doing something to your arteries, to your heart's electrical system, to your blood pressure, that builds and builds until one night it does not stop building. Cardiologists call it one of the most underdiagnosed cardiovascular killers in adults over 50. The American Heart Association has published warnings about it. Major peer-reviewed journals have documented the connection between this habit and sudden cardiac death during sleep, heart attack, and stroke for over 2 decades. And yet, in a standard 12-minute doctor's appointment, this conversation almost never happens. Your doctor checks your cholesterol. Your doctor checks your blood pressure. Your doctor looks at your EKG. None of those tests will show what this habit is doing to you right now. Tonight, while you sleep, I have spent 22 years as an interventional cardiologist. I have performed thousands of cardiac procedures. I have been the doctor called when the damage has already been done, when the only options left are a stent, a bypass, or a prayer. I am making this video because the conversation that could have prevented so many of those procedures was never had. I am having it with you now. By the end of this video, you will know exactly what this habit is. You will understand precisely what it does to your heart and your arteries while you sleep. You will know the warning signs already present in your body right now, and you will have a clear, specific plan to stop it, starting tonight. Not next week, tonight. Stay with me. Every word of what follows is information your heart needs you to hear. My name is Dr. Darius Coleman. I am an interventional cardiologist with 22 years of clinical experience. I have operated on hearts that reached the point of no return. The information I am sharing in this video is grounded in published research, major cardiovascular trials, and 2 decades of seeing what happens when this information does not reach people in time. If you are over 50, if you take any heart or blood pressure medication, if anyone in your family has had a heart attack or stroke, this channel exists for you. Please take 5 seconds right now. Hit the like button. Subscribe to this channel. I publish new videos every single week. Evidence-based, plain language information about the things that are actually affecting your heart that a standard appointment never covers. What I am about to share could be the most important cardiovascular information you receive this year. Subscribe, and let's continue. Section 1. The habit. What it is, and why it is killing people in their sleep. The habit is this: going to sleep with unrecognized, untreated sleep apnea, combined with 3 specific nighttime behaviors that the majority of adults over 50 practice every single evening without any awareness of what they are doing to their cardiovascular system. Now, before you say, I do not have sleep apnea, I would know. I need you to hear one number: 80%. 80% of moderate to severe sleep apnea cases in the United States are completely undiagnosed. Not slightly undiagnosed, not partially managed, completely unknown. The majority of people who have this condition right now, whose oxygen is dropping repeatedly every single night, have never been tested, have never been told, are living their normal lives completely unaware that their heart is under siege every night while they sleep. This is not a rare condition. The American Academy of Sleep Medicine estimates that sleep apnea affects approximately 30 million adults in the United States alone. 30 million people. And 24 million of them do not know it. The reason this matters more than almost any other cardiovascular topic I could discuss is the mechanism. What sleep apnea does to the heart during sleep is not subtle. It is not mild. It is violent, repeated, and cumulative. And when you add the 3 nighttime habits I am going to describe in this video, the risk does not increase by addition. It multiplies. Section 2. What happens inside your heart every time you stop breathing? Every time sleep apnea causes your breathing to stop. And in moderate to severe cases, this can happen 30, 40, sometimes over 60 times per hour. Your blood oxygen level drops. Your brain detects that drop instantly. It fires an emergency signal through your entire nervous system. Adrenaline surges into your bloodstream. Your heart rate spikes abruptly. Your blood pressure, which should be at its absolute lowest during sleep, giving your cardiovascular system its only genuine rest of the day, explodes upward. In documented clinical recordings, blood pressure during apnea episodes can spike from a normal resting 115 to over 200 within seconds. Then you take a breath, your body settles, your pressure drops, then it happens again. 15 minutes later, then 10, then 6, then 4, all night, every night, for months, for years. Now consider what this repeated cycle does to the inner walls of your arteries. Arterial walls are living tissue. They require smooth, steady, moderate pressure to remain healthy, flexible, and intact. They are not designed for violent, repeated pressure surges dozens or hundreds of times per night. Each surge damages the endothelium, the delicate inner lining of the artery. Damaged endothelium triggers inflammation. Chronic arterial inflammation accelerates atherosclerosis, the buildup of plaque inside the walls of the arteries that feed your heart and your brain. Narrowed arteries, reduced blood flow, increased clot risk. This is the direct mechanical pathway from untreated sleep apnea to heart attack and stroke. And it is happening while you are unconscious, while you believe you are resting. A landmark study published in the Journal of the American Heart Association followed thousands of adults over an 8-year period. The finding was unambiguous. Adults with severe untreated sleep apnea had a 200% higher risk of sudden cardiac death. And the peak risk window was consistently identified as the hours between midnight and 6 a.m., the sleeping hours, the hours when the heart should be at its safest. 200% higher risk, not 20, not 50, 200. That number should be in every doctor's office in this country. It is not, which is why this video exists. Section 3. The 3 nighttime habits that multiply your risk. Sleep apnea alone is a serious cardiovascular threat. But there are 3 habits, extremely common, completely ordinary seeming habits, that the majority of adults over 50 practice every single night that take the risk of sleep apnea and multiply it dramatically. Habit number 1. Alcohol within 3 hours of sleep. Alcohol is a muscle relaxant. Among the muscles it relaxes are the muscles of the throat and upper airway. The exact muscles whose reduced tone is the primary physical cause of obstructive sleep apnea. When alcohol is in your system at bedtime, your airway muscles are even less able to maintain the tone needed to keep the airway open during sleep. A comprehensive meta-analysis published in the journal Sleep, reviewing data from over 15 independent studies, found that alcohol consumption before bed increased the frequency of apnea episodes by an average of 25%. 25% more episodes, 25% more oxygen drops, 25% more emergency pressure spikes hitting your arterial walls while you sleep. On the nights you have a drink before bed, your heart is working significantly harder than on the nights you do not, and the relationship is dose-dependent. 2 drinks is worse than 1. Every night is worse than occasionally. Years of this pattern, in someone with undiagnosed sleep apnea, creates cumulative cardiovascular damage that no standard annual checkup will detect. The intervention is not elimination, it is timing. Finish your last drink at least 3 hours before you intend to sleep. 3 hours. That is the window that allows the muscle-relaxing effect to clear before your airway needs to hold itself open through the night. Habit number 2. Sleeping on your back. This is physics. When you sleep on your back, gravity pulls the soft tissue of your throat, your tongue, your soft palate, the surrounding tissue, directly downward onto the airway. For people with reduced muscle tone or any degree of existing sleep apnea, this position dramatically worsens obstruction. Published research in sleep medicine consistently shows that for positional sleep apnea, which represents a substantial proportion of all diagnosed cases, apnea events that occur 5 to 10 times per hour while sleeping on the side can occur 40 to 60 times per hour while sleeping on the back. The same person, the same night, the same heart. 5 to 10 episodes per hour on their side, 40 to 60 on their back. That is not a minor difference. That is the difference between a manageable condition and a cardiovascular emergency waiting to happen. Tonight, sleep on your side. Place a pillow behind your back to prevent unconscious rolling. This costs nothing, requires no appointment, produces no side effects, and the research is clear that this single positional change can reduce apnea severity by 50% in positional cases. Do it tonight. Habit number 3. Eating a large meal within 2 hours of lying down. When you eat a large meal close to bedtime, 3 specific mechanisms increase cardiovascular stress during sleep simultaneously. First, a full stomach physically elevates the diaphragm. Your lungs have less room to fully expand. Your baseline blood oxygen level at sleep onset is lower than it should be. This means each apnea episode drops your oxygen from a lower starting point. reaching depths of desaturation that increase cardiac stress and arrhythmia risk significantly. Second, large late meals cause a blood glucose spike, followed by a rapid drop during the early hours of sleep. This glucose fluctuation activates your sympathetic nervous system, your body's fight or flight response. When this sympathetic activation overlaps with the adrenaline surges generated by apnea episodes, the cardiovascular stress compounds exponentially. Third, active digestion requires significant redirection of blood flow to the gastrointestinal system. This places additional demand on the heart during the precise hours it should be at its lowest workload. For a heart already under repeated stress from apnea-related pressure surges, this additional circulatory demand is not trivial. The recommendation is simple. Close your eating by 7 p.m., 2 to 3 hours before lying down. This single boundary stabilizes overnight blood glucose, reduces diaphragm pressure on the lungs, and allows your heart the genuine metabolic rest it was designed to have during the sleeping hours. Section 4. The warning signs already in your body right now. Sleep apnea produces no pain. It produces no dramatic symptoms during waking hours, but it produces evidence that most people have learned to explain away, because nobody told them what it actually means. Warning sign 1. Morning headaches. Waking with a headache that clears within 1 to 2 hours is one of the most consistent and most ignored early signs of overnight oxygen deprivation. It is not tension. It is not dehydration. It is your brain communicating in the only language available to it, that it spent the night receiving less oxygen than it required. If this happens to you regularly, write it down. Bring it to your doctor. Use those exact words. I wake up with headaches that clear within an hour or two. That description alone should prompt a referral to sleep medicine. Warning sign 2. Waking to urinate 2 or more times per night. The standard explanation for nocturia in adults over 50 is prostate enlargement in men or bladder weakness in women. In a significant proportion of cases, that explanation is incomplete. Here is the mechanism that is almost never discussed. When apnea episodes occur, the pressure changes inside the chest cause the heart to release a hormone called atrial natriuretic peptide, ANP. ANP signals the kidneys to produce more urine. This is not a bladder problem. This is a cardiovascular reflex. Multiple clinical studies have documented that treating sleep apnea dramatically reduces or completely eliminates nighttime urination in patients who had experienced it for years. If you wake 2, 3, or 4 times per night, and bladder or prostate causes have been investigated without full resolution, ask your doctor specifically about sleep apnea. You may have been treating the wrong problem for a very long time. Warning sign 3. Blood pressure that does not fully respond to medication. This is one of the strongest and most consistently documented clinical associations in all of cardiovascular medicine. Resistant hypertension, blood pressure that remains elevated despite appropriate medical treatment, is directly and repeatedly linked in peer-reviewed literature to underlying undiagnosed sleep apnea. If your doctor has adjusted your blood pressure medication more than once, if you are taking 2 or 3 antihypertensives and still not reaching your target numbers, ask whether a sleep study has ever been ordered. In many patients, treating the underlying apnea achieves blood pressure control that years of medication adjustments failed to produce. Warning sign 4. Cognitive changes that arrived gradually. Difficulty concentrating in the afternoon. Words that used to come instantly that now require a moment. A memory that feels slightly less reliable than it did 3 or 4 years ago. A mental sharpness that seems to have quietly dimmed without any single identifiable cause. These changes are commonly attributed to normal aging. In a significant number of cases, they are not aging. They are oxygen. The hippocampus, the brain structure most responsible for memory formation and recall, is among the most oxygen-sensitive tissue in the human body. Repeated nightly hypoxia accelerates hippocampal cell loss at a rate measurably faster than normal aging produces. Untreated sleep apnea is now identified in multiple peer-reviewed studies as an independent risk factor for accelerated cognitive decline, and is associated in long-term data with earlier onset of dementia. The cognitive changes you are attributing to age may be reversible, but only if the underlying cause is identified and treated. Warning sign 5. Waking unrefreshed regardless of how long you slept. 8 hours in bed, 9 hours in bed, and you wake up feeling like the sleep did not work. Like you went to bed exhausted and woke up still carrying every ounce of that exhaustion. This is not a sleep duration problem. It is a sleep quality problem. When apnea episodes fragment your sleep dozens or hundreds of times per night, You are never completing the full sleep cycles your brain and heart require for genuine restoration. You are accumulating hours in bed without accumulating the restorative sleep those hours are supposed to contain. Unrefreshing sleep, despite adequate sleep duration, is one of the most specific indicators of sleep-disordered breathing. If this describes your mornings, that single symptom is sufficient clinical justification for a sleep study. Section 5. What to do. Specific steps, starting tonight. Camera direct. Energetic. Give this section momentum and clarity. Step 1. Change your sleep position tonight. Before any appointment, before any test, before spending a single dollar. Sleep on your side tonight. Place a firm pillow behind your back to prevent unconscious rolling. This is free. This is immediate. And for a large proportion of people with positional sleep apnea, this single change produces measurable reduction in apnea severity from the very first night. Do this tonight. Step 2. Move your last drink to 3 hours before bed. Starting tonight, not eventually. Tonight. This is not a permanent lifestyle restriction. It is a cardiovascular protection strategy with zero cost and immediate effect. Step 3. Close your eating by 7 p.m. Again, not a permanent dietary overhaul. A simple, sustainable time boundary that your heart will notice within days. Step 4. Request a sleep study this week. Call your primary care physician. Ask for a referral to a sleep medicine specialist. When you call, use these specific words. I wake up unrefreshed despite adequate sleep. I have morning headaches that clear within an hour or two. I want to rule out sleep apnea. That description will get you the referral you need. Home sleep apnea tests are now widely available. Many insurance plans cover them fully. A small device worn on your finger overnight can detect the presence and severity of sleep apnea without a night away from home. This single test may be the most important medical appointment you make this decade. Step 5. If diagnosed, take the treatment seriously. CPAP therapy, continuous positive airway pressure, is the gold standard treatment for moderate to severe sleep apnea. The data on CPAP outcomes is among the most consistent in all of cardiovascular medicine. Consistent CPAP use is associated with a 34% reduction in major cardiovascular events in patients with coronary artery disease. It reduces atrial fibrillation recurrence by over 40% in patients who have had cardioversion. It measurably improves cognitive function. It normalizes cortisol patterns. It resolves resistant hypertension in patients who have been medicated for years without reaching target numbers. I understand the mask is uncomfortable. I hear this from patients every week. What I ask those patients to consider is this. The discomfort of a CPAP mask is something you adapt to within 2 to 4 weeks for the majority of users. The outcome of an untreated cardiovascular event during sleep is something no one adapts to. Take the diagnosis seriously. Work with your sleep physician to find a mask fit and pressure setting that is tolerable. The adjustment period is temporary. The protection is permanent. The information I have shared in this video has been published in peer-reviewed journals. It has been presented at major cardiology conferences. It is not disputed in the medical literature. What is disputed, what has failed, is the delivery. Getting this information from the research to the person who needs it in the 12 minutes that most appointments allow. That gap is costing lives. You now have this information. Do something with it. Change your sleep position tonight. Respect the 3-hour alcohol window. Close your eating by 7. Call for a sleep study this week and share this video. Send it to your spouse. Send it to your sibling. Send it to anyone over 50 whose health you care about. Because this conversation is not happening in enough exam rooms, and the people who need it most are going to sleep tonight without it. Your heart has been beating for you every second since before you were born. Not one day off, not 1 hour of rest. It is asking you for one thing. One protected, uninterrupted, genuinely restorative night of sleep. Give it that. Starting tonight. I am Dr. Darius Coleman. Take care of your heart. I will see you in the next video.